Hello guys, I hope you're all okay. You're all enjoying your life. You're also enjoying watching my videos, practicing ultrasound, practicing radiology, and also benefiting the community at large. Today I'm going to discuss about the congenital abnormalities related to the bones, and it has a particular characteristic which is hyperostosis and sclerosis. That disease is called as Malorheostosis. Malorheostosis is a congenital abnormalities. It usually involve either single bone or multiple bone of the same extremity or the single extremity. It usually favor the lower extremity, but it spare the skull, it spare the spine, and it spare the face. So on the basis of these three features, you can differentiate it from the osteopetrosis. So Malorheostosis, it shows hyperostosis and sclerosis, predominantly periosteal, which gives rise to a particular appearance called as dripping candle wax. So dripping candle wax is a characteristic appearance. You cannot forget that. Like in osteopetrosis, we have discussed that there will be appearance called as bone within the bone. That is a particular appearance of the osteopetrosis. While in Malorheostosis, you can appreciate that the dripping candle wax is a particular appearance. Sometime interosseous linear sclerosis can also be seen. In the sub or periarticular region, you can appreciate small foci, osteoma type sclerotic foci can also be seen. So it has its own particular appearance. I'm sure you won't forget it. I'm sure you won't miss it when you are reporting the X-ray. So let's start watching these images for the confirmed diagnosis.
Malorheostosis can involve either single bone or there may be multiple bone but within a single extremity. It usually favors the lower extremity and spares skull and face, and it rarely involves spine. Malorheostosis pathology includes actually hyperostosis. This is a hyperostosis and sclerotic bone disease, so predominantly it will be periosteal and it will be undulating. The another important appearance would be dripping candle wax appearance. This is what of the pathognomic and identify this disease at the first spot. It may be endosteal or it may be intramedullary extension, so it can involve either endosteal or it may extend into intramedullary region as well, and sometime it may appear as a linear interosseous sclerosis as well. This is a lower extremity radiograph, and you can appreciate the femur, and within the femur here this appearance look like dripping candle wax because of hyperostosis, because of sclerosis, and it is extending into the endosteal area on the both side, so it looks like the candle is dripping its wax. So this is what the dripping candle wax appearance on the radiograph. This radiograph beautifully explains the hyperostosis and sclerosis involving distal phalanges, interphalangeal joint area, and proximal phalanx as well. So you can appreciate that there is a particular appearance of a dripping candle wax appearance, and as I told you, it may involve a single bone, or sometime in a single extremity it may involve multiple bones as well. So far the left hand is concerned, it's quite normal, and all the appearance is and pathology can be appreciated on the right side. So this is what dripping candle wax appearance. So this radiograph explains another feature, which is a linear interosseous sclerosis. So this is what linear interosseous sclerosis will look like, and it will again give rise to a dripping candle wax appearance. So it may be endosteal, periosteal, or interosseous. So this is what interosseous linear sclerosis. So this particular radiograph shows certain collective characteristics. It includes the interosseous sclerosis. It also includes some dripping candle wax appearances along the metaphyseal area, and small sclerotic pattern can also be recognized on these radiograph. So this is what the characteristics of Malorheostosis, the dripping candle wax appearances, may be endosteal or periosteal or interosseous. Again, the same radiograph for your better understanding. Here on this radiograph you can also appreciate that the index finger middle interphalanx bone also showing candle wax appearance, dripping candle wax appearance. So as I mentioned, it may involve single bone, or sometime in one extremity there might be a multiple bones involvement, which you can appreciate on this case. This is a chest radiograph with a presentation of Malorheostosis and hyperostosis and sclerosis. However, the radiograph quality is not that clear, so you cannot easily pick the points on that. But so far the clavicles are concerned, it appears to be a hyperostotic and sclerotic as well. So this was all about the Malorheostosis, and I'm sure you will be able to appreciate these on the radiographs.